How do corticosteroids help with asthma versus COPD? Imagine trying to breathe through a straw or feeling like your chest is squeezed tightly. That's what breathing can feel like with asthma or chronic obstructive pulmonary disease. Now, let's explore how corticosteroids can make a difference in these conditions. Corticosteroids are powerful medicines that help reduce inflammation in the airways. In asthma, the airways are often inflamed and swollen, which causes wheezing, coughing, and shortness of breath. These steroids work by calming that inflammation, making the airways less swollen and easier to breathe through. They also turn down the activity of certain genes that promote inflammation, helping to control the recurring symptoms of asthma. When inhaled corticosteroids are used regularly, they keep the airways open and prevent flare-ups, which is why they are a key part of long-term asthma management. Now, when it comes to chronic obstructive pulmonary disease, or COPD, the story is a little different. COPD is a progressive disease mainly caused by smoking, and it leads to airflow limitation that is not fully reversible. In COPD, corticosteroids are not the main treatment but are used mainly during flare-ups or exacerbations. During these times, inhaled corticosteroids can help reduce airway inflammation, which can lessen the severity and duration of these episodes. They are often combined with bronchodilators, which help open the airways wider. And like asthma, where inflammation is a central feature, COPD involves more damage to the lungs and less airway swelling, so corticosteroids are used more selectively. In asthma, corticosteroids are essential for controlling the disease and preventing symptoms from happening. They help keep the airways calm and reduce the frequency of attacks. In COPD, their role is more about managing specific episodes and reducing the number of flare-ups, especially in patients with frequent exacerbations or an asthmatic component. Side effects are also important to consider. Inhaled corticosteroids tend to have fewer side effects because they act directly on the lungs. Oral corticosteroids, which are taken by mouth, can cause more side effects like weight gain, bone thinning, or increased risk of infection if used long-term. Doctors decide which type to use based on how severe the condition is and how quickly relief is needed. So, in simple terms, corticosteroids help asthma by calming the inflamed airways and preventing symptoms, while in COPD, they mainly help during flare-ups and are part of a broader treatment plan. Understanding these differences can help you see why your doctor might recommend one approach over another for your breathing health.